Hello, I'm J. Stephen Morrison, Senior Vice President here at the Center for Strategic and International Studies, and we're thrilled and honored today to host Winnie Byanyima, the Executive Director of UNAIDS and UN Undersecretary General. Winnie, thank you so much for being with us.
Thank you. It's an honor to speak at the Center for Strategic and International Studies. Thank you for having me.
Thank you. I'm going to say a few words here. I'm joined with my colleague Sarah Allender in carrying forward this conversation. Sarah is now at Georgetown and has remained connected with us as a senior fellow. So thank you, Sarah, for joining us. I want to offer some special thanks to the team, the many people who worked really hard to put this together. From UNAIDS, Michael Hollingdale and Regan Hoffman were terribly generous in helping us pull this all together. From CSIS, we have Clifton Jones, John Mons, Trevor Hopkins, and my other colleagues, Maggie McCartan-Gibbs. And a special shout out to Shannon Hayter, the Deputy Director to Winnie at UNAIDS, who's a close friend. My opening remarks here, just a few quick points before we open the conversation with the first question to Winnie. We're in the midst of a very urgent crisis. We're in the midst of a situation driven by the COVID-19 pandemic of urgency and of high uncertainty. We're seeing in many of the low-income countries where UNAIDS is most critically important, multiple crises. We're seeing the arrival of the pandemic of COVID-19 amidst oftentimes very weak preparations and very difficult market conditions in being able to access those key things that are required, whether that is protective gear, tests and reagents, oxygen and the like, skilled training. We're seeing an economic crisis as the economies are deeply impacted by what's happening globally. And we're beginning to see a third urgent situation in terms of food insecurity and the threat of famine. The fear right now is that many of the countries in Africa and other low-income countries served by UNAIDS and others are going to find themselves at the back of the line, neglected and not being given sufficient attention as to what is required in order to manage these multiple crises while protecting the equities of all of the programs that are on the ground today that are advancing development and the health status of those populations, most notably programs like the Global Fund, PEPFAR, Gavi, the Vaccine Alliance, many national programs that cut across infectious diseases, maternal health, nutrition, and the like. This is a crisis also that's unlike any others in the sense that major powers who normally would be, I believe, rallying on behalf of low-income countries under threat are themselves under deep threat, facing their own economic crises. And we've seen a stark gap, a really disturbing and stark gap in the absence of high-level mobilization to rally around the needs of what is happening in low-income countries. That there's been some recent progress in that. Earlier this week, the EU hosted a session focused on mobilizing resources for the development of vaccine and therapies. And there was a lot of discussion around the need for transparency, equity of access to these medications as they become available, and making sure that those principles are adhered to. But we still have a big gap in drawing high-level attention to that. There is a huge amount at stake, obviously, at this moment in time. Africa has been missing, certainly in the United States, Africa has been missing from most of the debate around the pandemic. It's been dominated, obviously, by what is happening largely within our own country, where, as we know, 1.2 million people infected, 70,000 dead, and 30 million on unemployment rolls. This is a haunted tableau of American society, and somehow we have to figure out ourselves and others in Europe and in Asia that have gone through this phase to begin to look beyond that to these requirements here. UNAIDS has a very special role to play. It was born in the mid-90s amidst crises. Crisis is part of its mission. Crisis is part of the fabric of UNAIDS. Peter Piot, Michel Sidibe understood that and used their leadership and the powers that come with UNAIDS and being the executive director to great purpose. And so it's terrific now that we have Winnie Byanyima in this role now, 6 months in, and taking on this role at this moment of crisis. A few words about Winnie. She brings a remarkable assembly of experiences and expertise. As a young woman, she struggled against misrule in Uganda, joined the armed insurrection in the bush. She was the first Ugandan woman to graduate with a degree in aeronautical engineering, worked for Ugandan Airlines. She went on to serve as ambassador to France as a young woman, then entered parliament in Uganda. In the late 90s, I just want to say, as a side piece, she married Kizza Besigye, who has run 4 times for president as the major opposition candidate against President Museveni. We had the honor to host him in the 2001 election at CSIS, a most impressive and dynamic personality. Winnie headed the gender work at UNDP for 7 years. She served as the executive director of Oxfam International from 2013 until 2019. She was appointed in August 14th, I believe, by UN Secretary General Guterres to this current position. She took up her duties in November. So I think Winnie, you just bring this remarkable mix of being a politician, a diplomat, a development expert, an advocate, a longstanding advocate around social justice, around global equity, around transparency and the like. So let's turn to you now and ask you, tell us how you are seeing this crisis situation, and tell us how you can use your good offices and the power of your own leadership role to best advantage. We know it's difficult now. Many of the large international gatherings like the International AIDS Society, when people would be gathering and rallying and reviewing, are only going to happen in a virtual space. We know that Joe Biden's not the only person who's locked in a basement and trying to figure out how to connect to people. We're all struggling with that, yourself included. So thanks again for joining us. We're terribly honored. And why don't you kick off with some thoughts around what it's going to take in order, using your own office, what kind of strategy to bring across what is at stake and what needs to happen.
Well, thank you, Steve and Sarah, for hosting me. And you've summed what the problem is. It's huge. It's not usual. It's not happened before. We are facing a global crisis, but it is a pandemic. And I want to say something about pandemics, because here, where I'm leader at UNAIDS, indeed, as you say, we were born in the middle of a pandemic, and we know a thing or two about how to fight a pandemic. A pandemic is different from other health issues. It can't be solved like other health issues. We are in a crisis now that has taken so far 245,000 lives in just this couple of months. 3.5 million cases of infected people. I can compare it with HIV/AIDS. At the end of 2018, in 1 year, 770,000 people had died. 1.7 million newly infected in that year. And of course, we have about 40 million people worldwide living with HIV/AIDS, and about 15 million of them not yet on treatment. So we have 2 pandemics, and both are devastating the world. But we are our eyes on coronavirus now because of the huge destruction to the economies, to livelihoods, and total disruption of the world. But let's not forget, there's also another pandemic and other diseases, especially when you come to Africa. Indeed, I'll come to Africa. So with a pandemic, you can't get the solution purely, as I said, by driving for a health solution, because the infections and the deaths are not driven just by the biology of the disease, not just by access to medical centers, but by the social structures that exist in society. They matter. by the strength of communities on the ground to respond, that matters. The speed of scientific solutions coming into play, politics and prioritization, whose needs are prioritized, the legal environment. So you need a multi-sectoral approach and a global approach to turn around a pandemic. That's what we know from HIV. I'm worried, Steve, because I'm not seeing some of these lessons being learned fast enough. I'm hopeful, on the other hand, because I do see in many countries people building on what exists from learnings of HIV, the infrastructure, the social networks, the communities, but I'm not seeing all the lessons being learned at the same time everywhere. For example, I was happy to see that Massachusetts and California, when it comes to contact tracing, we're learning from Haiti and South Africa. So such connections and learnings are hopeful, but we need to do more. We need to move faster. Why? Because coronavirus has found the world, all countries, unprepared. What do I mean? What are the big things here? One, we've accepted and bought into a myth that publicly financed healthcare is out of reach, unaffordable, and we've experimented with selling health. So across the world, we have health systems that are not fit for purpose to fight a pandemic. Why? Because those who are most at risk, the most vulnerable, are poor, are voiceless groups, and they're the ones who can't buy health. So you're talking about Africa, more than 40 countries with user fees of different kinds. You're not going to turn around a pandemic when people have to pay money in order to go to do a test. You're going to roll those away. You cannot have a situation like I see in your country, where African American people are being cut down in huge numbers by a pandemic. Just that racial divide is unsustainable. It's immoral. It tells you something about the inequities in the society that the coronavirus is feeding on. So we need to rethink how we deliver health. Health as a public good, as a right that everyone should have. And it's not impossible to go back to those days, for example, post-Second World War, when health systems across Europe and Japan were built to provide for all. Or Thailand recently, after the global financial crisis and SARS, going out to roll out a system that reaches everybody, and that's primarily publicly financed. So that is one issue that we must take away. Secondly, preparedness. We've lived dangerously. We've not taken care enough about preventive health, primary health care, and preparedness for health risks such as this one. How to build that into a new health system is going to be our challenge. But I would also go to other issues about inequality in society and the voicelessness of communities, because you can see that where communities are engaged quickly, like in South Africa, where you build on a network of people who already know how to take charge of lives, of health in their communities, you move faster. So we have to rethink also other issues, such as how communities, local governments, civil society, how much voice and participation they have in governance. I've just read a report that showed, that did a survey of national responses to coronavirus. They are not showing that they've learned the lessons from HIV. One, they are not very transparent about who is deciding, who are making the decisions. The structures don't have women at the table. Most of them have very few women. The structures of governance are very much led by scientists from the fields of epidemiology and virology, not even other branches of science, leave alone the people who know how to organize communities, the social scientists and others are missing. And then you also find that through this same report that there is also an over-representation of politicians at the national level, less engagement of those at the sub-national levels. These are not the lessons we've learned. We need communities at the center. We need human rights at the center. The respect for human rights, we are seeing lockdown measures that are hurting people, and people haven't got avenues to demand. We are even seeing some risks of violence because of people being caged in and unable to feed themselves and also respond to public messaging. Trust is being lost when people are not consulted. So I could say more about the lessons to learn, but coming to the question of virtual working, Steve, I'm coming from another world. I'm coming from a world where we've been fighting for social justice, and the issue of climate action is close to my heart. I think we are being forced to work in ways that are more realistic than the way we have lived and worked in the past. Rich countries, rich people have lived carelessly, not caring about the limits of the earth. And now a disease has come to wake us up, and it's making us work in ways that are more responsible in terms of climate carbon emissions. So I think we are going to be more innovative about how inclusive we can be in our decision making, how we mobilize and get voices from the bottom into decision making, but we should not go back and seek to go back to the days of flying endlessly and emitting carbon like there's no tomorrow. So I am for using this crisis as an opportunity to take more stronger climate action. And thinking just today, I've been in a meeting, many meetings with different people around the world. Yesterday, we were in a meeting and got briefed. $8 billion were mobilized by the European Union and other friends to find a vaccine and to manufacture it. But now we need to fight to make it a global public good. But we are on the way through this virtual working. So it's possible we can adopt new ways of working and mobilize. But the vaccine, the global public good, you were talking about Africa, and Africa being at the back of the queue is real. The director for Africa CDC, Center for Disease Control, I was on the line with him a few days ago. He wants to take testing to 10 million tests in the next 4 months. He's invited UNAIDS to join in mobilizing community workers to roll this out. But Africa is at the back of the queue in terms of buying these test kits, trying to manufacture them locally, but not there yet. But Europe and the rich countries are crowding out Africa. When it comes to a vaccine, that could even be worse. So I'm working in coalitions with others to demand that there's an arrangement beforehand that agrees on the sharing of this vaccine as a global public good. Sorry, I could go on, but I think that the big challenges out there are to reform our global health, the way our approach to health in countries and globally. We need to look at it as an issue of rights and not put money before rights. We need to increase our preparedness for the future. And we need to fight inequality and put people and communities at the center. All this we can do virtually. We can organize virtually.
Thank you so much. I want to say just a couple of quick things, and then I want to bring in Sarah. On the question around community engagement, I think we need to remind ourselves that the Ebola outbreak in the Democratic Republic of Congo, which has been going on now for 2 years, at the very center of the response is community trust. And under WHO leadership and leadership by the government of Congo, we have reached a point of almost being totally successful at quelling that after 2 years of effort. And so, and that was through a very strong reassessment around how to engage with communities. And so there are some very important examples of leadership by Dr. Tedros, Mike Ryan, and all of the different, the more than 2,000 providers that have been mobilized, most of them from Africa. Another point I want to make, we have here at CSIS for the past 2 years, we've had a commission on strengthening America's health security, and we're continuing that looking forward. And this issue around the enduring inequities and the degree to which marginalized populations are going to take the greatest hit from the COVID-19. We are seeing that here in our country. We see this here in the District of Columbia. Over 80% of the case count and over 80% of the fatalities here in the District of Columbia are people of color who are poor and disenfranchised and poorly served. And that pattern is being repeated all across the United States. And it's something that we're going to see outside of the United States. And it's a priority for us as we're looking ahead in the next 2 years about this. I also want to just say, we are blessed with strong leadership in the form of, you just mentioned, John Nkengasong of CDC, Africa CDC, who we will be bringing on to a podcast next week about his work. We're blessed by Dr. Moeti. We're blessed by Dr. Tedros. There's strong leadership that we have today. And I think we need to continue to remind ourselves of how valuable that leadership is at this moment in time.
Would I come back to you about the disparities in the world? Because as our Secretary General of the United Nations has said, nobody's safe until we are all safe, that we are only as strong as the weakest health system in the world. We've found Africa has been found in a very weak and vulnerable situation. Why? At least 30 African countries today are paying more to debt repayments than putting in their health budgets. That's the role that debt is playing in the African economies. Secondly, I mentioned user fees. So many countries are collecting money from poor households to run the health system. If you think about the situation of the health system, I give an example of Zambia having one doctor to every 10,000 people, while Italy has one doctor to every 240 people. And yet we saw how Italy is struggling.
Yes.
Think of Zambia. We have at least 10 countries that have been found without even a ventilator, not even one in the whole country. So we have huge weaknesses in African health systems. If this virus were to take a trajectory as it is taking here in Europe, thankfully it is taking a different trajectory, we could have huge loss of life on that continent. So we need to move fast in terms of a coordinated global response, making sure that every country has the capacity to prevent, because there's no vaccine, there's no cure yet, but giving every country the capacity to prevent. So access to test kits, to all diagnostics, access to treatments, the few that are there for all countries is critical. We must address these disparities that exist in order for all of us to be safe.
Thank you. Sarah, I know you've got some questions. Come forward, please.
All right, thanks, Steve. Winnie, I'd love to talk a little bit specifically about HIV. You talked about the magnitude of the pandemic, particularly 14 million people still in need of treatment around the world. Large numbers, even of the ones that have access treatment, who are not yet virally suppressed and are thus immunocompromised. There's been a lot of concern reasonably around the vulnerabilities for people living with HIV and the risks with COVID. from the perspective of their individual health in terms of their vulnerability to infection and serious disease, but also the risks of service disruption and not being able to get the prevention, treatment, care, services, and medication that they need. How is UNAIDS gauging the impact, and what are you seeing thus far for people living with HIV around the world?
Many positive things and also some issues of concern. You're right. In high burden, HIV burdened countries, such as in Africa, you're talking about two epidemics, the coronavirus and the HIV epidemic colliding together. And we have to understand and look carefully to see that first of all, we are leveraging everything that we have learned about fighting a pandemic to ensure that the coronavirus is fought. But at the same time, we have to ensure that people living with HIV, people who are vulnerable to HIV, continue to have all the information and the services that they need, because we can't afford to have the gains rolled back because of a new disease. So we are watching, we are contributing to a new problem, and we are watching that what we have gained now continues to be there and available for the people who need it. So here are some of the things that we are seeing that are positive. I like to mention South Africa, where you see scientists like Karesha and Salim Abdul Karim, who are leading it. They are leading HIV researchers and are now heading a ministerial advisory committee on COVID. They are keeping their focus on HIV, but also contributing to this. We're seeing labs that were equipped for HIV being repurposed and used for both. These are some of the positive things that we are hearing, the use of the infrastructure and keeping an eye on HIV. But we're also hearing some things that are disturbing. For example, we hear that we are monitoring supply chains for the supply of commodities for prevention, treatment of HIV. And so far, we see that supplies are still coming, that value chains are not disrupted. However, we hear that with the need for more testing, more diagnostic, and even treatments coming, that some manufacturers may shift. For example, that the cost of a mask might be 10 times more for a mask than, say, a condom. And you could find a manufacturer shifting from a commodity for people living with HIV and for prevention, for those who are preventing, and switching to a coronavirus commodity. So we are watching supply chains for that. But we have not yet seen the shifts, but we are alerted. We are seeing, though, that people living with HIV are finding difficulty to reach centers to get their treatment. So we are advocating for multi-month dispensing, for differentiated service delivery models, so that everyone can be reached where they are. But certainly there are difficulties arising from lockdown measures for people to receive preventive or treatment. We are also hearing how vulnerability is increasing, and this is very disturbing. We've seen that violence against women and girls has peaked because of lockdowns. More people staying at home has meant that more girls and women are not safe at home. And we are looking at how to strengthen systems for preventing gender-based violence. Policing is important, community vigilance is important, women's groups working in digital ways to monitor is important. So we're working with partners to strengthen gender-based violence prevention. That's key. Sexual and reproductive health and services must keep going. But we know that sometimes it is those very services for groups that don't have a voice that are quickly repurposed and taken away for a new problem. So we're also watching for services and how for sexual and reproductive health services and other associated services are being provided. Communities and their voice in shaping the measures that are needed, because we see that these measures may stay in place for much longer than anybody thinks. If a vaccine doesn't come soon, prevention must stay in place. So for communities to be able to shape what works for them is critical. Right now, we are seeing blanket rules that, as I said earlier, are hurting people and making them more vulnerable. If people are more hungry, I've seen some people saying, I'm going to stop my medication because I'm getting weaker and weaker because I have less to eat. And then there's also the possibility that there may be more unprotected sex when people can't get a condom easily. And so more infection and more cost on governments in future to put people on treatment. So we are watching services carefully. We are sending out guidance on what governments need to do to keep services going. We are talking on rights and monitoring rights, the human rights of groups that are affected. In my country, Uganda, I'm not happy to say, I'm not proud to say, gay men have been picked up and arrested arbitrarily. It seems to be more about homophobia than any rule that they may have broken. So we are also watching out on the human rights of key populations, women, sex workers, of gay and lesbian men. Did I say lesbian men? Gay men, LGBT communities, transgender women. We are watching out for how their rights are affected by the measures in countries. And we are finding that many are struggling. My country directors have clear instructions to go out and fight and speak loudly and intervene with government when these violations happen. So those are some of the things that we are doing. And we're doing them with partners, with, as always, with civil society groups of people living with HIV on the ground, and trying to hold the ground on what has been gained and put the learnings into the coronavirus struggle.
Sarah?
Great. Do we have time, Steve, for another question before audience? Okay, great. Winnie, thank you for that. You highlighted so many of the issues that have been ongoing with HIV. I mean, they're magnified so much more with COVID. You know, this was supposed to be such a big year for global HIV, with the fast track milestones coming due at the end of the year, the big International AIDS Society conference, new strategies, the Global Fund, grants getting underway after the replenishment. We know that we were off track to begin with in terms of reaching 90-90-90. We were at 79, 62, 53 coming into the year. You highlighted so many of the issues that are affecting the ongoing programs and response. As you kind of think ahead to how we transition out of this year, we move past the initial set of milestones, how are you framing your thinking about where we're going globally with HIV and what the next phase is going to look like?
You know, in every crisis, I'm always thinking of where's the opportunity. And I think there may be opportunities here that will help us to maintain the momentum and to get back on track. Because you're right, coronavirus found us already off track. We are not on track to beat HIV and AIDS as a public health threat. So we have to do everything we can to seize opportunities where they are. One opportunity is in perhaps what is an emerging consensus about investing adequately in health, and health being more than this curative approach we have taken and building into health more on prevention, primary health care, and more on preparedness for epidemics, pandemics. So that consensus that is growing could be our opportunity, and we will want, as people from fighting an epidemic, want to bring in everything we know to get that shift at the global level and the country level on how to invest adequately in health. That's one. We will need to keep putting the problem of HIV within the context of epidemics and pandemics, and talking more about how to fight these diseases and focusing it on inequality. We can't have people dying of TB, malaria, cervical cancer, HIV, things that we could move faster to finding good treatments and get everybody on treatment. So injecting in there an inequality framing so that we have attention paid to problems that are solvable and finding solutions for them, and putting science at the center, getting science for these problems and not leaving them behind because they are for poor people, not a market, will not invest in them. So that shift, I think there is a political opportunity for it, for investing in those diseases hurting poor people and helping them to reach them. I think that we need to continue doing what we are doing, and that is empowering people living with HIV and vulnerable groups such as LGBT, such as sex workers, such as migrants, to organize and have a voice and demand. What we have now, the fact that almost 45 million people are on treatment today, did I say 45? 35 million people are on treatment today, is because of struggle, political struggle. They are on the best medications today. It's not because there were kind people out there and business became kind. It's people fighting for their lives. So we must continue building movement, putting more into these movements to claim their right as people living with HIV or vulnerable too, amongst others too. So we need to connect with the movement of those who suffer from TB. We need to connect with movements of now. We may have a movement of elderly people. We've seen how the elderly have been victims of coronavirus, but we need more movement building to get the politics to address the needs of the most vulnerable. That's critical. So those are some of the things that might turn this around.
Thank you. We're in the time that remains, I'd like to ask you two questions. I apologize, they're both big questions, which we don't have that much time, but I do feel like I need to ask these. The first question is, we're seeing a worsening confrontation between the US and China over many issues, but including the response to COVID-19. And that is something that worries many of us enormously, that in an era where we need solidarity and collaboration across the response, the science and the development of new technologies, ensuring equity and access and the like, we have this dimension. And I wanted to ask you the first question: how do you see this, and what might be done in terms of minimizing the impact that is going to have on this response? The second question is around the use of our existing mechanisms to respond to COVID. We're seeing the Global Fund create a pool of $500 million to bring response to using their procurement, their channels, their partnerships to infuse additional capital in on the COVID response. We're seeing Gavi, the Vaccine Alliance, do similar things. We're seeing PEPFAR beginning to think about this. Across the board, it makes sense that our existing mechanisms, including the World Bank, would become very important in this period in adapting, in being nimble, in being adaptive in order to bring about the kinds of resource flows that are needed on an urgent basis to overcome those deficits in protective gear, in tests and reagents, in bringing oxygen and the like. Two questions: China, the US-China confrontation, and then how do we make the best use of what we have in terms of these established mechanisms? Thank you.
On the question of the US and China, I'm hoping that this is perhaps an election issue that will blow over with elections, but I'm more worried about a multilateral system that is in tension itself. The broader multilateral system does need to have some reforms that will make it more able to deal with global challenges such as this one. But I'm hoping that US-China relations will improve. What I'm seeing, though, that's hopeful is that you see a region such as Africa, poorest, most vulnerable, working well together, pulling it together, trying to procure commodities to fight this and test kits and diagnostics and treatment, pulling together to buy together, to take out competition, to test together. That's a good example. We need to see the global community seeing this as a global problem and introducing a strong global coordination. US and China need to come to the table globally in the multilateral system, and we fight together. Regarding the mechanisms for financing a crisis like this one, definitely, we are in a good place. We are in a good place because of what we have learned from fighting HIV/AIDS. Institutions such as the Global Fund are there. They know how to channel resources right down to communities. They work with us. We are like their feet on the ground who help them to bring communities to shape responses that work for them. So those are some of the advantages we have. A global fund that has been working to channel resources with support from UNAIDS and others down to where the battle is. The World Bank too. I've been talking with the World Bank and they've opened a window, which I am working with them on, but they need to learn how to finance not just governments, but to finance people, because this pandemic is fought by people on the ground. So I'm trying to work with the World Bank to help them revisit their funding modality, how they work with governments, put communities at the table, NGOs, non-health people, and get a response that is truly going to have an impact on people's lives. So we have the mechanisms, and that's a positive.
Thank you so much. Just in closing, could you tell us, this is a very dangerous, difficult, dark, unprecedented period right now. It's a 100-year pandemic. We're all struggling with this. It's urgent and it's dangerous and it's highly complicated. When you wake up in the morning or when you go to bed at night, what gives you the greatest strength and the greatest hope looking ahead?
Okay. I have with me in this apartment, which I'm renting in Geneva, my son. Is a 20-year-old young man going to school, going to college in America. When I am engaging with him, I see a totally different generation from us. I see somebody who is intersectional. He thinks about health. He thinks about climate. Just yesterday, he told me that I mustn't buy a small packets of yogurt. I must buy the big one because he doesn't want to pollute. He's always conscious of the environment. He's conscious of health. He doesn't smoke. He doesn't do the things that we experimented with in our generation. So I'm hopeful because we have a young generation that is thinking about its future and that is more health conscious than us. And if we put young people into our decision making, we are likely to reach better decisions. We've been seeing this COVID killing old people. And I'm so sad because you don't even see their names there. It's just numbers. It's so sad. But yet, we know that we must build a world that's more capable of solving problems. And I keep going back to young people coming into decision making as a big part of the solution. And of course, women, and women being part of the solution. We saw how frontline workers are mostly women, and they were totally unprotected, and countries were not ready to protect them. So for me, the people who matter, if they are at the table, will arrive sooner at solutions. Young people, women, and the most marginalized, like LGBT communities.
Winnie, thank you so much for being with us today. You've shared an enormous amount. It's been a very rich, I've learned a great deal listening to you, and I'm sure everyone else has. And thank you for your leadership and your service at this, in the many different walks that you've had in the course of your very remarkable career. And we look forward to continue to engage with you. You're always most welcome here at CSIS at any point, and we look forward to supporting the work of UNAIDS in this critical moment.
Thank you for having me, Steve and Sarah. It's a privilege.
Thank you. We'll connect again.
Thank you so much, Winnie.
Bye-bye.
It's been a pleasure talking with you.